I am Charlene Hamilton. I am in the Seattle area, in the traditional lands of the Snohomish people, so north of Seattle. And I have been a birthing from within mentor for almost 20 years now, and a UBI feet on the ground sort of fan advocate for about 5 years now. Started a blog, started a Twitter feed, have hit like 3,000 followers and have no idea how that happened. I don't have a background in economics at all. I tend to think somebody had a quote once of, economics is astrology for math professors. I was like, yes, that makes sense. So when it gets into some of the deep nitty gritty of, how do you pay for this? And how does this work? And I don't always know the answers to that. And I'm happy to point at other people who have done more of the work on really detailed things. What I like to talk about is the basic personal impact that a basic income can have. And just to make sure we're on the same page, what I mean by a basic income, and I like to say a unconditional universal basic income, to make sure that those two concepts are included in the idea, that it is universal. It happens to everybody. It's not needs-based, it's not means-tested. And it's unconditional, meaning there's no strictures on how you have to, what you have to do to get it. Do you have to be this enough? Do you have to be that enough? It's, in my universe, a basic income goes to everybody. And a basic income fundamentally is the government through collective funding, i.e. taxes. Taxes are our membership dues into civilized society. This is how we get the cool stuff that makes our lives function, is by making sure that things are funded. So the government, using collective funding, provides its citizens with a baseline income every month. Usually that number is between 1,000 and 2,000. When I started, 1,000 was, yes, $1,000. It's, with inflation and discussions about minimum wage and cost of living increases, that's moved up to 2,000. That every person in the country should get $2,000 a month individually, not by household, by individual. And that becomes important, that we want to do it by individual. And this makes us, not only a foundation, it builds a solid foundation for everything else to build on. It also, as a culture, says nobody deserves to exist below this level of income, this level of cost of living. It's taking that poverty line that we have, in the US, we have a federal poverty level, and that gets recalculated like every 5 years. And that depends on, that informs how much people on welfare get, how much food stamps happen, how you qualify for housing, et cetera, et cetera. What a basic income does is say, here's the line. We're not going to let anybody go below that. We're taking that poverty line, and instead of having a safety net that's got holes in it that people can fall through, we're building a foundation. So that's part of why I'm really passionate about basic income, is that idea that nobody should have to start at zero. Right now, we have everybody starting at zero. And a basic income says, no, you start here, because below this is unacceptable to us, for human beings to have to try and survive. So that, in a nutshell, is what I'm talking about when I talk about a universal unconditional basic income. And there is lots of information out there about what a basic income does and how it works and how it impacts. But I want to specifically talk about how having that stable foundation, having that floor at 2,000 instead of 0 per person, how that would impact childbirth in our culture. How does that impact how families prepare for birth, how they get through birth, how they get through postpartum? What does it look like? And I want to start with, how does this impact birth professionals? The first thing it does is impact who can become a childbirth professional. Midwifery school, doula trainings, childbirth educator trainings, all of these things that we think of as fundamental parts of childbirth outside of medical school for OBGYNs or nursing school for labor delivery nurses or certified nurse midwives. Those programs can be paid for through scholarships and through federal financial aid in the US. And I'm coming from a very US centric position here because that's what I'm familiar with. I know there are things that are different in other countries. So my perspective is from the framework of how the US works. Outside of those people who can get federal financial aid, and some midwifery schools, you can get federal financial aid. But in general, the trainings to become a lactation consultant, a doula, a CBE, any of those things are self-pay. Which means the people going into those roles are people who already have financial flexibility and very often a spouse that's paying the bills. So this primarily means middle-class white women are very often the face of being a doula, the face of being a midwife. This is changing. And in other areas of the US, it's never been the white women. But the act of going into one of these professions requires a level of financial privilege that many people don't have, even if they want to, even if the thing they want the most is to be able to be a doula or a midwife. And then they look at how much is going to have to come out of their own pocket, not only to do the training, but then to go into practice. It becomes financially unobtainable for many people. So one of the things a basic income would do is increase financial flexibility for people who want to become birth workers and people who are birth workers now who are, I would love to do more births, but I can't afford childcare. I would love to do more pro bonos or low cost births, but I have to meet my bills. So having a guaranteed amount of money that is coming in every month, say, if I, as a doula, knew that I had $2,000 coming in every month, no matter if I was able to have clients or not, I would be able to do more advertising. I would be able to do more outreach. I could do more continuing education to strengthen my skill set. I could go to conferences. It would just make the entirety of the childbirth world more accessible to me as a professional, where I wouldn't have to go, oh, I really want to take this spinning babies workshop, but I can't afford the travel and the hotel and the conference workshop and. I know if I have a month where I don't have any clients, my bills are still paid because I have this basic income. So right there, we have people who are working, who are contributing to society. We'll just, you know, we'll take the soapbox about that judgment value and the idea that you're only contributing to society if you're in paid employment. We'll just set that soapbox over there so we don't get sidetracked, because that's a really easy one to go off on a tangent on. But you know, here you have people who are doing work, serving their community, whose ability to serve their community, whose there's ability to work with the people around them, to be available as a provider to the people around them, is suddenly made tons easier because they have that stable financial floor. Because they have the option of going to midwifery school or taking a doula training or being able to find childcare that they can have at a moment's notice. Because, you know, for many doulas, that's the biggest challenge is, what if I have a birth and my spouse has to find childcare at 8 o'clock in the morning before they go to work because I'm still at a birth. Having childcare that has that level of flexibility and that sort of drop in, that tends to be more expensive than here's the daycare that's open from 10 a.m. to 6 p.m. Does anybody have any questions? Well, so that's where I first came at this as a birth worker, is, you know, having read about basic income, and it's something I'd heard about for years, but had kind of gone, I don't know. When I started learning more about it, I was coming to it from the perspective of a birth worker of, you know, I teach childbirth education classes. To have a space to teach in, I need to have people in the classes. To get people signed up for classes, I needed to have a space to teach in. So I needed to have capital. I needed to have a previously unclaimed, unbudgeted, disposable income to have some place to teach. And as I was researching basic income, it was like, this would make life so much easier, because I would be like, this is the money I'm using to build my business. Because childbirth education is not something you can really go out and get a bank loan for. It's not retail. It doesn't have that same thing with starting a doula business. It's not a guaranteed return on investment that banks look at and go, oh, hey, yeah, we think you'll make $10,000, $20,000 a month. Go for it. Yeah. So that idea that having a stable financial floor would support everything else I want to build on. More classes, more clients, more advertising, more outreach. That's what a basic income can give us as birth workers. And a lot of those same concepts translate over to, what does it give birthing families? So the first thing that we know, there are studies out there, is that financial stability makes you healthier. Poverty makes you sick. We know this. Poverty takes a mental and physical toll on the body. It's emotionally exhausting. It's physically exhausting to be poor. When you have financial stability, when your needs are being met, if you're familiar with Maslow's hierarchy of needs, I mean, what, the large truck goes by. Maslow's hierarchy of needs, the foundation of that is food, shelter, safety. You know, everything we need, the basics we need to survive. And as you put in more layers of stability, you're able to expand what you're doing for yourself and your community. So when you're not having to stress about your basic needs, when you're not having to exist to survive, your physical and mental health improves. And this is true. This is true not just for the poor, it's true for the middle incomes too. When you don't have financial stressors, the level of stress on your body improves. So just right there, by not having financial worries, by having that floor that a family knows, okay, there's two of us in this household, two kids, we're pregnant, and we know that we're never going to go below this number each month. We're always going to have this income. We know that our bills are going to get paid. We don't have to worry about where food is going to come from. That pregnancy is going to likely progress in a better way. There's more likely to be physical health. There's more likely to be mental health. There's more likely to be emotional health. And this is where the idea of the income being based on the individual and not the household becomes important, because it can increase health and safety in families where domestic violence is happening. One of the strongest leashes and tools that abusers have in their toolbox is financial control. When you talk with people who have escaped an abusive relationship, often one of the things they talk about is, I didn't know what I would do to support myself. I didn't know how would I support the kids? How would I feed the kids if I left? He controls the money. They control the money. By having a basic income attached to the individual unconditionally, that means somebody who's in a violent situation or abusive situation, and again, domestic abuse does not have to involve the physical. It can be entirely emotional. By having an income that they know, even if they go and live in a shelter or a hotel or move in with their parents, or they have to go move to another state and try and hide, they have an income that goes with them, that they know will be there and waiting for them. That makes a huge difference. That freedom to leave a domestic violence situation not only would just baseline improve their physical and their mental health, it could save their life. So not only do we have making the foundation be here at 2000 instead of 0, the societal foundation of nobody should have to live below this line, saving lives, we have the direct impact of it could make it so that somebody can flee a situation that's dangerous for them, and not just somebody who's married. LGBTQ people who are unsafe in their living situation could leave. People who are in a religious situation that they're uncomfortable with could leave. It increases the ability of self-determination. So the next thing that UBI does that could impact birth is it increases employment freedom. If you don't have to work to survival, if you don't have to literally take whatever job is available so that you can put food on the table, you can look for jobs with real benefits that aren't exploitative, that aren't working you 28 hours so that they don't have to give you the benefits that they're supposed to give you after 30. it means that employers have to treat their employees like human beings and not like a resource. Which means for somebody who's expecting, it could mean access to better healthcare options. Insert rent about single payer healthcare here. Their spouse could have better benefits. They could leave a job that was causing them physical harm. If they're already in a job where the fact that they're pregnant is suddenly becoming an issue, we know that's an issue in employment, that people who are pregnant find barriers to their upward mobility, to what tasks are expected of them, to how much time they're given off, to returning to work to infant feed. Somebody could say, I'm taking the last month of my pregnancy off. And even if they decide to fire me, I still have financial stability. I can make that choice. I have the flexibility because I know I have this baseline. It becomes a way to hand power back to the employee. And that's true for any worker, not just expectant families. Right now, so many of the jobs people are in are, well, I could just replace you. There's no power, there's no strength to say, you need to treat me better as an employee, because the employees are seen as a disposable resource. Witness the nobody wants to work anymore. It's like, that's not true. People want to do things. What they don't want is substandard wages and substandard working conditions and minimalist benefits. They're starting to step up and say, no, we are worth more than what you are trying to give us for our labor. And a basic income would just strengthen that, because then it would be, no, you're not working me 25 hours so that I don't get benefits and only paying me $7.25 an hour. That's not okay. And that financial stability also will increase consumer choice. Right now, somebody who's expecting very often may find that their choices of where to give birth, who to give birth with, who to have on their birth team, may be restricted by their insurance policy. And in rural areas, that can be even more acute. Right now, because we don't have single payer healthcare and the US is a ditz, midwives, birth centers, doulas, childbirth education, lactation consultants, all of those things are very often an out-of-pocket expense. So even if somebody is like, I would like to give birth in a birth center, I would like to give birth at home with a certified professional midwife, they may call around and find, oh, I don't have that sort of disposable income. We don't have that room in our budget to add another $300 a month payment plan. So we're going to have to give birth over at St. John's with, Dr. So-and-so, because that's who's in the area that the insurance covers. And maybe you're looking for a, low medical support, as physiologically normal as possible birth. But if St. Joe's has a 27% cesarean rate, what are your odds? If your state has a 33% cesarean rate, how hard is it to find someplace that your insurance covers that is going to meet your needs and match your goals for birth? So having that financial baseline, having that basic income says, we know we have this, our bills are met, and we have this money coming in. We could use it to pay for a doula. We can use it to pay for a midwife. For families with lower incomes, that may be exactly what they need. Oh, okay, we have this buffer. We can pay, we can work out a payment arrangement with the midwife or the doula so that we can have the type of birth that we're wanting. These things become options. Postpartum, we can hire a postpartum doula to come and support us through this period of massive adjustment where we're having to relearn how to exist in the world. We can access these resources that we couldn't have if we didn't have a basic income. So again, there's where just having that floor suddenly increases everything that can be put on top of it. If you tried to pile all of these things in our existing social safety net with all its holes and its frayed threads, and it doesn't really meet here, and you can only be in this part of the net if you meet these certain parameters, the net breaks. We don't have a secure social safety net in this country at all. And a basic income, we could go, okay, I really need a doula. And I am terrified of hospitals. I need childbirth education classes that are going to prepare me for whatever comes up in my labor. Whether it's being able to have the home birth of my dreams, or if I need to transport. And then I need postpartum care because I already have 3 kids. And I could really use an extra hand because my spouse works graveyard. So all of those things have a better base to build on. And that becomes especially important for traditionally at-risk or marginalized populations. Our BIPOC populations, our Indigenous populations. Those populations where they are struggling with poverty to begin with, where they're struggling with institutionalized racism that limits their access to positive outcomes, that treats them as less in the birth space. All of those things that we know increases positive maternal and infant outcomes. Doulas, midwives, postpartum care, regular prenatal care, not having to drive 6 hours to get to the nearest hospital. All of those things that we know makes things better, but isn't necessarily covered by insurance, or are considered, especially in a lot of areas, doulas are considered a luxury. They're a luxury expense. Childbirth education, comprehensive childbirth education that isn't the hospital, which those are perfectly good classes, but are often focused on, here's what you need to be a patient at our facility. Those things are considered luxuries. They're not accessible. They're not there for the people who really, really need them. This is why here in Washington, they're working on the Doulas for All program. They just got doula licensing, the foundation starting to be built here in Washington. But even in the places where Medicaid is and Medicare is already paying for doula care, there's still a fight in making sure that the doula is getting a living wage. With states only paying, less than $400 for the birth and the prenatal visits and the postpartum visits, that's not sustainable for the doulas. So you have doulas not taking state funded clients, which rolls us back to why this basic income is good for providers, because it means that they don't have to feel like, oh, if I take too many of these low income clients, I may not be able to meet my bills, but these are the people who would really benefit. And there are tons of organizations who are working to bring these services to these traditionally underserved, marginalized communities, these areas that our system just completely overlooks. But it's definitely not meeting all of the need. It's just not. What can we do systemically as a society to start making it easier for these resources to be available? Give a basic income. Do a basic income. And that kind of becomes the entire, how do we make the minimum wage debate better? Well, we start with the basic income. How do we talk about job guarantees? Well, we start with the basic income. We'll get into that. There's actually here in Seattle, I just heard about, this was really exciting, Hummingbird Indigenous Family Services, which is a birth providers for Indigenous families, Indigenous doulas doing traditional birth practices and traditional work, is partnering with the Urban Indian Health Institute, and they're starting to have talks about a basic income for pregnant families. Like they're starting there. So technically it's not the unconditional universal, but this is where a lot of basic income trials are starting. They're saying, let's take a specific population and give them a basic income and see what happens. They're starting to have talks with pregnant people, Indigenous pregnant people, Indigenous birth workers in the area. How do we set this up? What would this look like? What would be most beneficial about this? Because the idea that just give people money and let them use it how they need to is actually taking off. It's starting to become, more in the cultural consciousness. It's not this out there thing that the wild socialists talk about, which over in UBI Twitter land, we get that all the time. Oh, that's socialism. No, it's not. No, it's not. They made the same argument about Social Security back in the day. You can go and find buttons and signs and advertisements in the paper, reject socialism, reject communism, don't let don't let Lyndon Johnson give us socialism. And now, nobody over the age of 65 can exist without their Social Security payments in most cases. One of the ways I've heard basic income described is Social Security for all. Sort of. Social Security as it is, it still has some means-based testing to it, and it's not. So, in a nutshell, that's what basic income does for birth. That's how basic income can support birth. Overall, pregnant health increases with financial stability and access to skilled care. We know these things. We know it. There is study after study that financial stability makes people healthier. So why not give them that financial stability? Why not make sure, if we have to start somewhere, let's start with a basic income for pregnant people. Of course, you will get the argument, welfare queens, people be just popping out babies to have basic income, which is part of why we need to get it to universal. So if it's universal, if everybody's getting it, you can't do the argument of how come they get money, free money, and I don't. It's like, because you are getting free money. You know, it really reduces the us versus them, because there is no them. It's all us. If everybody is getting it, if everybody has the same baseline, you don't get to say, why are they, what have they done to deserve that I don't. So in a big way, it increases social equity. It increases this baseline idea that we deserve to survive because we are human beings, not because we're selling our labor to others, not because we've gone to college or done specific things or are doing specific worthy things. Right now, our means-based social services are the haves, i.e. the government or the whoever's setting the tax, the income guidelines for the year, saying only these people deserve our help. Those are the only people that are worthy. They're not, it's not, in a big way, it's not really about helping. It's about making people be grateful that we're helping them. And then if they step out of line, taking away that help as fast as we can. A universal unconditional basic income can't be taken away. It can't be taken away if you suddenly get a job. It can't be taken away if you move or you change counties or you get a divorce or you separate. It's there. It's the solid ground under your feet. Does anybody have any questions or thoughts? So if this is a subject that you're more interested in, I have a Twitter account where I babble about UBI and occasionally other political things, and retweet Jorts the Cat's union celebrations, because evidently our newest, power to the workers person is actually a kind of silly orange cat, and I love him. It's women for women for number 4 UBI on Twitter. I also have a blog under that name. That's a little bit older. I haven't been doing as much blogging as I'd like, but I will make sure this video gets up there too. Other people you're going to want to pay attention to, there's a guy named Scott Santens. He's really been doing a lot of research into UBI for years. So a lot of his resources and talks are really comprehensive about what a basic income is, what it can do, what it doesn't do. It doesn't cause inflation. We know that. It doesn't make people not work. We know that. There have been basic income trials. There was actually a basic income trial in the Nixon era. So in the 70s, there was a UBI trial in several major cities in the US, including Seattle. And it was incredibly successful. They were seeing really good numbers. And then somebody got a hold of the numbers. I can't remember the exact details off the top of my head, but a group saw the numbers and it looked like the number of divorces was going up. And the family values people had a conniption, because we're giving people money and it's destroying families, it's breaking up families. Well, yeah, because financial freedom. Oh my gosh, you mean I don't have to stay with this person? Yeah. So the trials were all stopped, even though they were showing really good. So we could have had a basic income since the 70s, instead of not having had a minimum wage that's been raised since the 70s. Yeah, it's Scott Stanton's. Let me go grab his Twitter account, because that's where most of his links are. And I'll give you mine too. I had these pulled up and then the window closed because technology. Okay, so here is my Twitter account, Women for UBI. And then here is Scott's. Where are you, Scott? What's really interesting when you dig into UBI is the things that are constant. All UBI people think this, these things in general. And then there's a lot of discussion about how would it be funded? Do you make it, how much? Do you make it UBI? Do you not? Do you need things like, does UBI replace social services like welfare, like food stamps, like unemployment, like Social Security? Does it replace it completely, or does it go on top of it? Does it, I have heard of Michael Tubbs. I don't know if I follow him. I'd have to look. The name is familiar though. Stockton's one of the places that's doing a UBI trial. I believe they're doing $500 a month. I mean, we saw it when we had the child tax credit happening early, happening throughout the pandemic instead of just getting it with your taxes. Yeah, he's the mayor who organized the pilot study. Yeah, just giving people money makes things go better. They're trying to argue that it's that's why inflation is happening right now, but if you go and look through the numbers, it's not. It's CEOs getting $1 million bonuses. Economics is astrology for math majors. That's just and that idea that we can tell the health and social health of our society by how rich people are doing is silly. The health and I'd even say legitimacy of our civilization is determined by how we're treating the poorest. And in that benchmark, the US is really crappy. Pardon my French, but we're so bad at it. We're so bad at it. We're patchworky. So in my thought, yeah, you could use UBI to replace welfare payments. We wouldn't need to have multiple agencies doing cash payouts. If we have one overarching one, and then those agencies could be doing things that are more targeted to the needs of their immediate community. Instead of having to have the majority of their budget be we cut checks for people, they could be doing job training, they could be doing counseling, they could be doing increasing access to childcare. They could be doing all these other things that need to happen that get shoved aside because we just need to cut a check. Same thing with unemployment. If we weren't paying into unemployment every month out of our paychecks, and we had a basic income and we became unemployed, the unemployment department could be working on vocational training, better job hunt searches, not just go and get a job as fast as you possibly can so we don't have to give you more money. For a family that's pregnant, that what do I do if my spouse or myself becomes unemployed, or I'm pregnant and I'm working 2 jobs because I'm trying to keep the roof over our head, how much of a weight would a basic income lift off of their shoulders? Just that knowledge that no matter what happens to them, no matter what life throws at them, and the statistic is, like 70% of Americans are 1 paycheck away from financial disaster. Something happens in their pregnancy and they're going to need the NICU. What happens when their insurance doesn't cover all of those bills? Single payer healthcare. It's just the amount of things that a basic income could just fix. And it's not a magic wand. I don't think I've ever seen a single UBI proponent, even though this is an accusation that gets thrown at us, that we think basic income will fix everything and everything will be wonderful and there will be a utopia. It doesn't. It's not going to make the systemic failures of our society to support minorities, to support indigenous, it's not going to fix those things. It's not going to magically fix the housing crisis. It's not going to magically fix homelessness. But a UBI with postal banking, that could really make a big impact on homelessness. I know I totally tangented off of UBI and birth, but it's all interconnected. It's all interconnected. I mean, the core of it is that a basic income provides a stable foundation. And then we can build a society and the things our society really needs on top of that, including better pregnancy and postpartum care. Does anybody have any questions or thoughts? No? Well, then I really want to thank everyone for being here. And I will make sure to get this uploaded, or if it decided to not do speaker view, it's giving me a weird thing. If it decided for some reason to not give me a nice picture of me on the recording, what I will do is re-record this. I will re-record this talk and post it for everybody to see. I will make it a public thing. But I really appreciate you being here and listening to me. And I hope that you have a really good rest of your week, that you have a great weekend, and that you start talking to people about basic income, because it's a really powerful tool for change, for systemic change, not just mandating a few things. Thank you so much for being here.